As this baby reminds us, breastfeeding is best for the baby, best for the mother, and best for the family. Research confirms that breastfeeding strengthens a baby's immune system, helps prevent childhood illnesses such as respiratory infections and gastroenteritis, and decreases lifelong illnesses such as asthma, obesity, and diabetes in the baby. Listen as this mother describes the benefits of breastfeeding for her baby.
The whole time I was breastfeeding, I never had to worry about, the ear infections and the colds and all of that. It really boosts up their immune system.
And she is thriving, and I know we just looked at her growth chart, and she's completely balanced between her height and her weight.
Mothers who breastfeed have decreased breast and ovarian cancer, less cardiovascular disease and diabetes. They lose their pregnancy weight more easily and suffer less from postpartum depression. Though babies and mothers benefit from any breastfeeding, exclusive breastfeeding significantly increases all these benefits. Families who breastfeed miss less work, have fewer medical expenses, and save money by not buying formula. Bringing your newborn to the breast within the first hour, avoiding use of a pacifier, and keeping your baby in the room with you will facilitate the bonding experience and promote effective breastfeeding. Avoiding swaddling and keeping your baby skin to skin during the first few days of life, whenever you are awake, are actions that increase breastfeeding hormones, lower stress responses in you and your baby, and help a mother notice when her baby is ready to eat. A newborn has special ways to communicate that she is hungry. She might bring her hand up to her mouth, smack her lips, or wiggle and squirm like this when she is ready to eat. Because a woman's breasts do not feel different immediately after birth, some women worry that they do not have enough milk. However, the birth of your baby initiates important changes in your hormones and breasts, changes that provide exactly the nourishment your baby needs. On day 1 and 2, mother's first milk, colostrum, contains important body-building proteins and antibodies to fight infection. Since a newborn's stomach is the size of a marble, he eats only about a teaspoon at each feeding. Fortunately, colostrum is very concentrated and perfect for your newborn. Many mothers benefit from a nurse teaching her how to hand express colostrum, especially if the baby is extra sleepy on day 1 of life. As shown here on this breast model, the mother first places her hand in a C shape around the areola and nipple. Next, she pushes breast tissue back toward her chest wall, compresses the breast tissue, and then releases it to express a small amount of colostrum. Hand expression will increase milk production and help if breasts are engorged. Most babies exhibit cluster feeding on day 2. They want to eat more frequently when mother's milk is about to come in. Putting baby frequently to the breast will both calm the newborn and build up the mother's milk supply. By day 3, mother's milk typically comes in, and the baby's stomach increases from the size of a marble to the size of a table tennis ball. Now a baby can eat up to 30 milliliters, 1 ounce at a time. Adding water or any formula unless medically necessary can interfere with milk production. Obese mothers, mothers with diabetes, high blood pressure, or thyroid disease during pregnancy, or mothers who had a C-section or challenging birth might experience a temporary delay in their milk coming in. A nurse or doctor might suggest supplementing with donor milk or formula until mother's milk supply increases. To create and maintain both a good milk supply and adequate nutrition for the baby, it is necessary to bring a newborn to the breast 8 to 12 times a day. Your newborn's behavior may initially be confusing to you. New parents often wonder whether their baby is going off to sleep or just shutting down from too much stimulation. Look at this baby. Her face is relaxed. There is no tension around her eyes or mouth. Her skin color is uniform. However, the baby on the right is demonstrating a shutting down response to overstimulation. He looks like he is squeezing his eyes shut. Notice the tension around his mouth and eyes, and that the color on his forehead is not uniform. When this baby is comforted skin to skin, he will soon begin to wiggle and squirm and be ready to eat again. Many mothers are surprised to learn about a special hormone, CCK, that is released in both the newborn and the mother as she breastfeeds. This hormone relaxes the mother and causes a newborn, like the one we see here, to get very sleepy after nursing for only 10 to 20 minutes. If your newborn falls asleep after breastfeeding a short while, mother can put the baby skin to skin. In about 10 minutes, this hormone level drops and the baby begins to wiggle. The mother can now put the baby on the other breast to complete the feeding. During the first week, you will know that breastfeeding is going well by tracking your baby's weight and noticing the number of wet diapers and the number and color of your baby's stools. Healthy breastfeeding babies initially lose from 5 to 10% of their birth weight within a few days. Her weights in the hospital and follow-up weights at your baby's clinic visit within the first few days after discharge will confirm that your baby's weight is changing as expected. She should regain her birth weight by 2 weeks of age. During that first week, a baby typically has 1 wet diaper and 1 stool for each day of life. Parents expect to see at least 1 stool on day 1, 2 on day 2, 3 on day 3, 4 on day 4, 5 on day 5, and 6 on day 6. Breastfeeding a new baby brings tremendous joy, immense satisfaction, and sometimes unexpected questions about how to care for your newborn. Your family, friends, and healthcare professionals are here to encourage and to help you get off to a good start and to meet your breastfeeding goals. Contact your healthcare provider or a community lactation consultant if you have any questions or concerns once you are home.